Now we can start talking about midlife. And what we consider midlife has changed over the years. In the 50s and 60s, midlife was considered around 40, but with the extension in life expectancy and improved health in the top healthiest part of the population, midlife is now closer to 50 in males and about 40 in the mid 40s in females. One of the big differences in considerations in health in midlife is the difference between males and females with regard to bone density. Now, keeping in mind that bone density is affected by several variables. One is just the genetic predisposition for how the bone mantle is going to thin with age, but also activity level has a pretty dramatic influence on maintenance of bone density. So a sedentary lifestyle with very little stress on the bones can result in much more rapid degradation of bone density in females. Some studies have been done that show that actually low weight, slow rate exercise in females have been found to actually maintain or increase bone density. So bone density peaks at about age 18 for females and about 20 for males, and then you see some natural decline, which increases the probability for bone fractures. Bones become more porous. So what we'll look at is what are some of how to diagnose and set a baseline for bone density and how to treat the results of a decrease in bone density called osteoporosis, which is mainly a problem in females. One kind of standard in primary care now for females entering midlife is to do a DXA or dual image X-ray absorptiometry test to get a baseline for bone density. And then after, in subsequent exams, comparisons can be made between the current state of density of bone and the baseline to track any decline in bone density with age and take steps to reduce the curve, the decline in bone scan. Now, some of that may involve supplements like calcium supplements, and some of it can involve use of medications if it's more severe. And also the encouragement of activity and exercise to help maintain bone density. The principal problem with, or cause of bone density decline in females is the reduction of the effectiveness of estrogen in their system. Because estrogen is a hormone is responsible for the maintenance of bone density in females, medications have come online in recent years to help treat and prevent more severe decline in bone density and the resultant fractures, especially in high stress areas of bone, like at the epicondyles in the long bones, and also the emergence of stress fractures. So the class of drugs that have been most effective in this they're called the Selective Estrogen Receptor Modulators, and SERMs actually operate in two ways. The Selective Estrogen receptor modulators, that means that they operate on different tissues in different ways. So with regard to bone, they tend to upregulate the effectiveness of estrogen receptors in the bone and in the liver. But they downregulate the reception of estrogen in vulnerable tissue to cancer, like breast tissue. So they're effective at preventing cancer, breast cancer, and in reducing bone density decline. Another common onset in midlife of some a disease process that can cause problems in functionality is arthritis. Now, there are two kinds of arthritis. There's a overused form of arthritis that's called osteoarthritis, and it's primarily sets up in tissues that are under constant inflammation, joints, and the soft cartilaginous tissues in the joints can begin to ossify as a protection mechanism provided by the immune system, but this can reduce the movement, range of motion in these joints, and then that can cause pain and decline in the ability to move, which then exacerbates the problem. Also, people that suffer from arthritis are less likely to be able to exercise, so then that can lead to a variety of other secondary medical problems as a result of the decline in the ability to exercise. So the other form of arthritis is an autoimmune condition called rheumatoid arthritis. And rheumatoid arthritis actually comes in a couple of forms. One is reactive arthritis, which is when a disease process like food poisoning or a severe bacterial infection or viral infection can trick the immune system into attacking healthy tissues in the joints, and that can cause pretty severe pain and immobilization. The other form of rheumatoid arthritis is relapsing remitting rheumatoid arthritis, which can, or progressive rheumatoid arthritis, which can start actually in early adulthood and leads to much more severe declines in functionality and pain. And so what's come online recently in years is treatments for arthritis that have been shown substantial progress, especially in rheumatoid arthritis. The infusions and what are called disease-modifying agents have been really effective at helping people maintain their functionality, because the same thing can happen in rheumatoid arthritis that happens in osteoarthritis, and that is that you can see a general decline in health as a result of inability to move. Also, chronic pain can lead to depression, which reduces a person's motivation to stay active and socially engaged. So chronic pain too is one of the principles behind the opioid crisis, because, and that's basically the result of just mismanagement of pain, attempt to use opioid medications to try to treat pain, chronic pain, which has been shown to be pretty ineffective. Here's just some information on rheumatoid arthritis, more advanced information. I won't be testing you over this, but for you folks that are looking at going into some form of health science like medical school or nursing school, there are specific kinds of rheumatoid arthritis that dictate what times of treatment are effective and what the prognosis is going to be. So seropositive RA, which is when you test positive for the anti-CCP or RF factor, that is a familial form or genetically inherited form of arthritis that results in severe decline in functionality and a lot of distortion in the joints. And this is one that has been pretty effectively treated in recent years by the new infusions. The seronegatives are rheumatoid arthritis is people that test negative for the RF protein or anti-CCP protein, and so they are likely to have less severe symptoms, and it's a much milder form. Now, one of the principal differences in the sexes in midlife is the way that their sexual response cycle works, or or reproductive ability. So the whole process of decline in fertility in females from perimenopause to menopause is called climacteric. So climacteric is this continuum of change that you go from starting in midlife and until you get into menopause. So perimenopause is when you have irregular ovulation and menstruation, and menopause is when you have complete cessation of ovulation and menstruation. Interestingly enough, perimenopause is a time period where you have a risk of pregnancy resulting from sort of a false belief that some women believe that they are no longer fertile because they're not having regular menstrual cycles. And so this is when a gynecologist or a nurse practitioner may warn them, to maintain some kind of birth control if they're not intending on having another child. Also, pregnancies during menopause are automatically high-risk pregnancies and will result in a referral to a perinatologist. And there's been an increase in these late life or midlife pregnancies in recent years as women have become educated and more involved in their careers and have delayed having babies until they get into early midlife. Now, midlife and perimenopause can be an uncomfortable condition for females as they transition into menopause. But most of that is the decline in estrogen and progesterone, which are important hormones for maintaining, some of their physiological processes. So night sweats and insomnia and irritability can all be a product of a decline in the effectiveness of estrogen in their system. So there's been a discussion in the past and various protocols on replacing the estrogen and progesterone with hormone replacement therapy. So what the protocols have changed because hormone replacement therapy can also raise the risk for breast cancer and other forms of gynecologically related cancers because you're ramping up estrogen in the system. So there are some additional considerations, a family history of breast cancer, and then a change in cancer screenings, and a conversation about how to make decisions about whether to use hormone replacement therapy or not. But it can, in appropriate candidates, lead to a more gentle progression through perimenopause into menopause with less discomfort. Now, young adults are much less susceptible to the effects of stress on their health, but when you get into midlife, you start to see the effects of long-term stress on health. And now, stressors usually begin with physical routines that are stressful or attitudinal or psychological stressors. And the things that help us cope with stress, the traits that help us cope with stress or make people somewhat more resilient to stress are anchored in personality traits and how effective their resilience coping strategies are. But the responses that you get from long-term stress come in three categories: physical, psychological, and behavioral. And these are not mutually exclusive. Actually, psychological stress, for example, causes endocrine changes that can lead to physical consequences like coronary artery disease, hypertension, risk for stroke, and inflammation, and just a general increase in inflammation. Also, the behaviors that result from attitudes, the psychological attitudes, the behaviors that result can create stress cycles, and these stress cycles can ramp up by acting on the attitudes or acting on the psychological factors that can create behaviors that actually increase the stress responses and have more physical implications as far as their physical stress. Also, behavior tends to be a feedback mechanism for psychology. And so if a person acts on their stressful attitudes, then the action actually ramps up the attitude or supports it. So that's a consideration here when you look at long-term effects of stress. Now let's look at the stress cycle. So this is actually a cycle developed by Hans Selye, which we'll talk about on the next slide, having to do with how to cope with stress. This is an important concept in health psychology and becomes really important in people in midlife as they're looking at their general health. So what you have is, and not all these factors may be present, but this is a stress cycle that has some components that might be an issue with someone in midlife. So you have daily stressors, and then you have an acute intense stressor, which everybody has from time to time, and those are cumulative. So they're the more you have a baseline of a fairly high daily stressor, and then acute stressors actually are exacerbated by the daily stressors. And then if you have you can have a situation where you have a lot of sensory overload. So this is when there's too much sensory input, so noisy, difficult environments with too much stimulation. Chronic stress can result in a suppression of the immune system or a distortion in how the immune system works. This can lead to disease, which can be, either a chronic condition that a person has made worse, or conditions that are directly related to stressors, like heart disease and hypertension and other problems like that. So, and that all accumulates to create the stress cycle. Now, what Selye defines here is a system where you have stressors that are recurring, and you have the normal response to stressors, which has to do with resistance, and your ability to do that's related to how resilient a person is. So it's normal to have alarm level stressors. These are the acute stressors, followed by coping in some way or another, how a person responds to that stressor. So you have increases in adrenaline, and then you have defensive responses to the stressor, and that's called resistance. A person may actually, over time, be able to return to baseline again after an acute stressor. But what happens with the stressors when they're too frequent, or for whatever reason the resistance breaks down, that the person's resilience breaks down over time because of fatigue or the effects of stress, then you can get exhaustion. So exhaustion is when the system gives way to the stressors, and that's when you start seeing increases in inflammation and an immunosuppressant response. When I worked with patients with multiple sclerosis, as a consultant for the MSAA, which is the Multiple Sclerosis Association of America, this was one of the things we taught the people that have multiple sclerosis, because they have crises that come from their MS, and that's these kind of recurrent alarms. And then over time, because of the disease itself, their resistance breaks down and exhaustion sets in, and then the disease progresses at that point into some severe phases. And in the relapsing remitting cases, that can be like abrupt cases of blindness or problems with motor function. And so this cycle in a person that is under constant stress can begin to have can result in physical consequences and more rapid aging. Now, these can be divided into different kinds of stress factors. External stress factors are those in the environment. So marital problems, family problems, career and financial problems, loss of basic functioning in people that have some kind of disease state like arthritis or IBF, or IBS, or irritable bowel syndrome, Crohn's disease, rheumatoid arthritis, heart disease, things like that, or anything that restricts their movement or functioning, loss of sensory function. And then just environmental discomfort, some of which we're well adapted to and some of which we can become maladapted to, like overuse of air conditioning and not adapting to a more variety in our temperatures, and avoidance of, which we'll talk about later, but avoidance of any kind of discomfort, like parking right next to the door all the time and avoiding having to walk places and things like that, which can have a detrimental effect on a person's health. Right now with the COVID-19 pandemic, we're seeing a ramping up of problems with family, marital problems, and we're inundated with television media that's sort of plays on a lot of fear, and there's a lot of contradiction and anger in our politics, and so that's having some effect on attitudes, and which can have an effect on people's basic functioning. And those attitudes are things like the internal, are part of the internal stress system. So feeling inferior or having feelings of inferiority, having problems with acute and chronic pain, the resultant depression or anxiety that results from the risk of disease or risk of loss of functioning, even just concern about aging. Sensory overload. Our environment is awfully noisy and busy, and our system's really not well adapted to that. In fact, if you go out and find yourself a forest somewhere or an area out in the woods and stand there for a minute, and the first thing you're going to notice is it's quiet out there. So we don't manage sound very well, and also we probably use electronic devices too much, so spending too much time in front of computer screens. Being on the cell phone all the time, having earplugs in all the time, and not allowing your system to have any kind of downtime. I've worked with patients, especially young adults that are having problems with stress, about having just too much sensory input and not enough downtime. And then frustration leads to a ramping up of aggression and cynicism and pessimism, and so those are all attitudinal problems, and attitudinal problems are internal stress factors. So let's look at some biology here, and that's stress and physiology. So what exactly causes us to get stressed, or what's going on internally? So stress hormones are those hormones that are actually designed to protect us. You're supposed to flee or fight whenever you're under threat. So epinephrine is a natural hormone that's adrenaline, which is released by our adrenal glands, and that is supposed to protect us. So that gives you the fight or flight response, and you see a ramping up of heart rate, respiratory rate, and vasoconstriction in your extremities, and it pulls blood in towards the mediastinum, the big old vessels in the middle of your chest, and all that's designed to help a person flee or exert the kind of energy they need to protect themselves in a threat situation. But we're also designed to go back to some state of normality afterwards. But if over time, recurrent pings of this adrenal response can begin, you start to see a buildup of a stress hormone called cortisol. And cortisol is what leads to chronic hypertension, hypercholesterolemia, which is an imbalance in your low and high density lipoproteins. You have increased low density lipoproteins and decreased high density lipoproteins, and that creates coronary plaque and all the problems can lead to blood clots and problems like that. So raises the risk for stroke. So these can have negative effects on your physical health, but they also have negative effects on your mental functioning as well. So this system where your brain's connected to your endocrine system in your body is called the hypothalamic pituitary adrenal axis. And there's actually, interestingly enough, this is the axis that is modified with medications in people with chronic depression. So selective serotonin reuptake inhibitors like Prozac, Zoloft, the Effexor, Paxil, all those medications, they all are similar in their action. But what they do is they act on the hypothalamic pituitary adrenal axis, as well as, the anxiolytics do this as well. So we have medications that actually intervene in that link between the hypothalamus and the adrenal system to reduce the effects of alarm and stress. So we can review the brain here a little bit. There's a limbic system which has the hypothalamus, and the hypothalamus is the structure in the lower part of the limbic system that's responsible for the basic drives and temperature regulation. So, and it does a variety of other things. Mate selection's in there. The hypothalamus is a very complicated structure in the lower part of the brain. The hypothalamus is the part of the brain that is connected to the adrenal system through the pituitary stalk. So it connects to the pituitary gland. So the hypothalamus sends signals to the pituitary gland, and the pituitary gland is the master gland for your endocrine system, and that's what causes the release of hormones. So the pituitary gland has a variety of functions. The growth hormones secreted from there. It controls your metabolic rate. That's in your thyroid. It sets up the ovarian cycles, ovulation, menstruation, and it controls the formation of spermatogenesis in the testes. It helps release pancreatic hormones for digestion, and it's responsible for commanding the adrenal cortex, which is the one that sends out all of the signals that speeds up your heart and respiratory rate and helps you prepare for acute stressors. Also, your water and salt metabolism is all regulated by this master gland. Pituitary gland is extremely important. From an anatomical standpoint, it has its own little bony saddle there in the lower part of the skull called the sella turcica. So even if you just look at this as an anatomist, you'd know that this is a extremely important structure. It's not in the brain, it's actually below the brain, but it's extremely important in that it is the master regulator for all of the endocrine systems in the body. And so the adrenal medulla is the structure in the adrenal gland that causes the release of adrenaline. So that's the end stage of the hypothalamic pituitary adrenal axis. Now, in Hans Selye's resistance, we're talking about resilience. And so resilience, you could think of it as the predisposition for having an enduring resistance to stress. So resilience is an important concept. And it turns out that resilience is tied into several things. It's tied into attitudes, it's tied into physical activity, and there are certain characteristics of resilient people that have been studied by health psychologists to kind of determine, what makes a person resilient. Like, what traits do resilient people have? So what they find is that they have, when you give them a Rotter locus control scale, they'll measure as an internal with regard to locus of control, which means that they have high levels of self-efficacy and confidence. People who have an internal locus of control also they have a tendency to be optimistic. Resilient people tend to be optimistic. So optimistic people tend to deal much better with stress. Resilient people have higher levels of emotional intelligence, which means that they exert control over emotion. They tend to be more proactive as a result and able to delay gratification, set goals. Resilient people tend to be more active and socially engaged, so they have better social support systems as a result. Interestingly enough, in working with people who are struggling, socioeconomically and physically and all in the past, um, uh, what I would do to coach them sometimes in their interaction with public service agencies was looking at their attitude when they present for healthcare, for example, or when they present for services. People that are struggling and in some cases homeless, or they've got medical problems but no access to medical care. The problem is there are a lot of those people, and they tax the systems pretty significantly. So we would do a little attitude check. I know, get them to look at those systems as social support systems and actually approach those people to sort of be able to improve the chance that those people be willing to help them by seeing them as a good social support system. Also, resilient people tend to have a remarkable sense of humor, as opposed to people low in resilience who have less of a sense of humor. And a sense of humor seems to be tied pretty well to this resistance phase and the ability to cope with stressors. One thing that I noticed in being in Great Britain, in London, is that Londonites are hilarious people. They generally have kind of a dry, humorous way of dealing with things. When they insult you, they use humor to do it. When they're angry about something, they talk about it in humorous ways. It was real notable that when they were being attacked by Germany in World War II, and they were bombing London on a daily basis, there was a lot of use of humor to try to resist the enormous amount of stress that was placed on them. And as a consequence, they were able to get through the Blitz. When I was in the Army, I served with people from Australia and from Great Britain. And they were stationed in Iraq with our units. And that was another thing I noticed about them, was the British and the Australians were always comical, always, even in bad situations, under attack. They're the ones that there's a lot of humor. And I've noticed this in resilient people. Firefighters, police officers, military personnel, medical personnel in the emergency room, they tend to use humor to cope with their stress. So these traits of resilience people are also clues as to how to become a resilient person. And I would say principally, fitness is the best way to increase resilience. In fact, it's really difficult, if not impossible, to be at your maximum level of resilience without being somewhat physically fit. Now, you don't have to be athletic, but just being fit makes a big difference. I can tell you from working with quadra and paraplegics, with people that have had traumatic amputations, these are mostly military veterans, that the ones who engaged their physical therapy and thought beyond that, got involved in like the Paralympics and things like that, those are the extraordinarily resilient people. Emotional intelligence really helps, and that is to get in the habit of thinking proactively, use cognition to voluntarily change attributions or threatening attributions, deciding how to react to situations without letting emotions make the decision for you. Those are the kinds of things that increase resilience in people. So, although emotions are always a reaction, thoughts are not. They can be reactive, but they're usually proactive. So this gives us the ability to choose emotions by controlling them with attitudes. And these attitudes, these cognitive components, come in two types. For an appraisal is how you define how emotionally provocative a situation is. Like, how should you react to a situation? That comes from your appraisal. So a primary appraisal is how bad is it? And that's just the level of threat that a situation seems to have. A secondary appraisal is what is my level of efficacy in dealing with this situation? So if I have a solution ready, or I have the confidence to deal with the situation, then even if the primary appraisal is this is really bad, a secondary appraisal is, but I know what to do about it. So the more skills a person has or experience at a given kind of threatening situation, the better they are at dealing with it. So, a good example is to watch like Apollo 13, the movie about what the astronauts went through in the late 60s when they had an explosion on their spacecraft on the way to the moon. Now, these people had trained and were probably significantly resilient to begin with, but in that situation, in the most threatening situation they could be in, the movie really, because they got consultants from the actual astronauts and from NASA when they made the movie, they were really good at portraying how they kept themselves cognitively in control, as well as the people at NASA on the ground. So that was a really good example of what effect a secondary appraisal can have on you. Firefighters aren't frightened by fire. That's because they train to be firefighters. Police officers are not threatened or not fearful in threatening situations. Soldiers are not fearful in threatening situations in the same way that non-soldiers or non-police officers, non-firefighters, or non-medical personnel are. So they have trained to affect that secondary appraisal. That's even true in flight training. Your instructor is going to shut your engine off periodically while you're flying, and then you're going to have to go through the protocols to get your engine started again. And that's to build the secondary appraisal. An engine out in an airplane is always, from a primary appraisal standpoint, very bad. That's because of gravity. But the secondary appraisal varies. The more training you have, the more experience you have, the more it modifies the secondary appraisal. So appraisals are related to our explanatory style. And that is that our view is our reality. It's our perspective. So perspectives are affected by a person's explanatory style. That is how they choose to think about situations. And a person can choose to think about situations to get the emotion they want. And that's how a person can have voluntary control over their explanatory style. Just like when someone says it doesn't matter or it just doesn't matter. That was actually a common thing that soldiers in Vietnam, especially draftees, that had come out of the low-income neighborhoods and went to Vietnam, they would, whenever people start to get down in bad situations when they were in combat, they would say, "It don't mean nothing." That was their, like, none of this means anything. And it was their way of kind of disconnecting from the threat. And that helped them survive. Okay, let's look at something we've kind of talked about a little bit already, but that's the difference between fluid and crystallized intelligence. And this is a very important concept when you look at cognition and long-term mental functioning. So fluid, let's just look at review the two here for a second. Fluid intelligence is information processing. This is your mental power, your ability to process information from short to long-term memory. So this is mental flexibility and encoding information. This is youthful intelligence. So this peaks out in early adulthood. It gets real strong in adolescence, and it's related directly to your aptitudes. Crystallized intelligence is your expertise. That's knowledge acquired through learning and experience. So this is more age-related intelligence. So what you have here is two processes. Fluid intelligence, which allows you at your peak aptitudes to gain experience and process in a lot of information for storage, and that will build your crystallized intelligence. So the more a person builds their knowledge base and their experience base early in life, the more they can harvest that later, because fluid intelligence will naturally decline when you get past midlife and into aging. But crystallized intelligence doesn't decline until you get into far late life, depending on how healthy you are. And so what you do is you fill the tank early, and then you harvest it later. And that's why it's really important when people's aptitudes are real high that they put in the work, that they get the experience base down, they encode the information, build vocabulary, really do the mental work early, because you're going to harvest that later. That's, you even see that in athletics, because baseball, for example, requires extraordinarily fast reaction time. And once you get past your late 20s, your reaction time is going to slow significantly. And so that's going to make it hard to stay what they call in the show if you're a Major League Baseball player. But the fact that they've seen every possible play thousands of times gives them the ability to anticipate the plays. So actually, even though their physical reaction time has slowed, their ability to play up to the tempo they need to play, sometimes into their mid-30s and later, depending on what position you're in, enables them to do that because they've built that experience base, and they're going to harvest that later on. So the concept of fluid and crystallized intelligence was proposed by Raymond Cattell in the early 70s. And Cattell had developed a personality measure called the 16 Personality Factors Questionnaire. And he was looking at, that led to sort of tracking personality changes with age. And that's when Cattell started thinking about, well, what happens with cognition? And what you could say from Cattell's viewpoint is that cognition doesn't decline with age, it changes qualitatively. And so that's back to that idea that you have a reservoir of information that you can draw from later on in life. And what you can see with this building of expertise is a increase in practical intelligence. This is actually a concept developed by Sternberg when he really challenged the notion of a single measure of intelligence. He included practical intelligence with creative abilities and analytical abilities. And so executive function is related to emotional intelligence, practical intelligence, and that is the ability to plan, think logically, engage in critical thinking, which is a healthy skepticism. That's when you don't take things at face value. You require more information. Something that's really important these days because of the disinformation out there and the disinformation campaigns that are going on constantly. Even in advertising, being able to think critically about the things that we hear in advertising. The ability to delay gratification, which tends to improve as people get into their 30s and go through age 30 transition, they get better at delaying gratification. But you can see this in very high functioning kids, the ability to delay gratification at a very early age. A Harvard study even showed that they could see a relationship between 5-year-olds' ability to delay gratification and success later in life. And so you see drops in impulsivity with improvements in executive function. Nothing that's important about this is executive function is impaired when someone is a chronic drug abuser, like alcohol abuse or use of other toxic, very toxic drugs like methamphetamine or cocaine or the opioid drugs. Now, some of that's acute, so you can see recurrent, some healing of mental function, but some of it can be pretty chronic. One of the things that's a consideration in people that have head injuries or brain function problems that are the result of chronic substance abuse is that they're going to have problems with impulse control and things like that until the brain heals up. I've said this often to people that are getting over methamphetamine addictions or alcohol addictions, that their brain is damaged and it's going to take time for it to heal. And that's why sometimes we're looking at a year or two of healing to see an improvement in brain function and a return of executive function. Now, when we look at personality theory, after a lot of debate in the literature about how many personality traits we have, McCrae and Costa boiled it down to 5 fundamental personality traits. And these are the ones that are enduring and mutually exclusive, which means that you can have any combination of these 5 personality traits. Once they developed the 5-factor theory, the next question was, well, how do these things change with age? So let's first review the 5-factor theory. So neuroticism has to do with how anxious, hostile, self-conscious, depressed, impulsive, or vulnerable a person is. So highly resilient people, for example, are low in neuroticism. Extroversion and introversion, that was a fundamental concept that had to do with field sensitivity. This is the degree to which people are impacted by stimulation from the environment. So highly field sensitive people are subject to sensory overload at a much easier level. So they prefer not to engage so much socially. People low in field sensitivity tend to get bored easily, so they do engage in a lot of social interaction. So people low in field sensitivity are extroverted, and people high in field sensitivity are introverted. So, and then that's a continuum, by the way. Most people are somewhere in the middle, slightly introverted or slightly extroverted. Openness to experience is just, how flexible a person is to new things. Agreeableness is how generally happy somebody is, and tolerant of other people. Conscientiousness is perseverance and the ability to delay gratification and set goals. So let's look at these 5 factors and how they change with age. So studies have shown that neuroticism actually declines with age, that people have a tendency to be much more rangy in their affect when they're young, but over time you see declines in neuroticism. Interesting enough, when you compare males and females, females show a much more dramatic decline in neuroticism with age than males do, because they have a wider emotional range of expression when they're younger than males do. Introversion and extroversion is kind of a stable trait. You don't really see a significant change. People will have a tendency to be a little more sensitive to too much information. And that's because as cognitive function slows a bit, our tolerance for lots of varying stimuli may slow a bit too. So you could see that if anything changes with introversion and extroversion on the scale, that most people are going to become slightly more introverted with age. Of course, if somebody's already very introverted, they're not going to see as much change than if somebody's very extroverted. Openness to experience, generally people become less open to experience with age. But interestingly enough, uh, midlifers that are very generative tend to be more open to experience, and they age at a slower rate. So being open to new experiences, actually in this sort of hyper-technical age we live in, helps people stay adapted and take advantage of some of the technologies that can actually help a person cope with aging. Cell phones, for example, are significant, especially smartphones, and use of the internet with search engines and email and social media platforms that are advantageous for staying in contact with family members and friends. All those things can slow down the aging process and keep a person engaged. The rejection of those things can leave a person significantly behind, like not being able to bank online can be a real problem. And trying to be on a cash economy, that can be a real problem. And not using email or smartphones. Smartphones can help a person in situations where they may be at risk. For example, being able to use GPS on a cell phone can keep a person from getting lost. And so those are all, and having a calendar on a cell phone right in your pocket can really help somebody as they age. That helps them with, if they do have a tendency to lose some of their prospective memory, which is memory for what's supposed to happen next or what you're supposed to do. That can really help. Most people become more agreeable with age. And so they become a little more tolerant and agreeable with the people around them, unless they're in a lot of pain or something like that. And then most people become more conscientious with age because they just naturally become more disciplined. So Erikson's stage in midlife already made reference to, and that's generativity versus stagnation. The syntonic state is generativity and the dystonic state is stagnation. And stagnation is what I was talking about when I say that people don't like to hang with younger folks. They reject new trends. They have difficulty adjusting, and they're going to fall behind. And that's the whole battle between the generations that actually affects older folks much more than younger folks. So a young person doesn't need older people to collaborate with as much as older people need younger people to collaborate with, although younger people do need some mentoring from people with more experience. And so that can be really helpful to them. But if you get left behind in the trends, that can, especially the technological trends, that can really lead to some significant problems and advanced aging later on. Now, generativity is that whole process of wanting to stay engaged, being positive about younger people, and being willing to take on the role of being a mentor to somebody in more of a dialogue kind of mentoring, where it's not just instruction giving, but it's kind of a back and forth dialogue. Generative adults tend to adjust better to aging and they remain more youthful. And I see this a lot in cyclists because I know cyclists, I've done it all my whole life. I ride with young people and older people at events and races and things like that. I don't race as much as I used to, but in cycling, you see a lot of people in advanced age that are very youthful, and people in their 60s and 70s that are on a bike at these at the Hotter Than Hell 100 and Peach Pedal and Austin 100. You'll see these people that are out there, and they're very youthful and very active and very positive. And so you can see people that are in that generative state and the effect it has on their aging. So we hear a lot of discussions about the midlife crisis. And there's actually kind of two forms here, both of which I've categorized as more of a midlife crisis negative and a midlife crisis positive. But you can have what's called a midlife crisis, which is when a person has a lot of anxiety about, regrets from the past and their future. And some people can make ill-advised decisions, based on their anxiety. They can resist being engaged. They can have an anxious reaction and make changes in their family status or things like that that may not, or economic changes, financial changes that may not be in their best interest. A midlife correction is when a person reevaluates their life course and then they make some changes that can improve their life course. And this is something health psychologists deal with a lot. When you're doing health promotion with people, sometimes it's necessary to have a real grounded honest conversation with them about the direction they're headed, the vector that their life is on. And that involves, look at these unhealthy habits and what is the prognosis if you continue on this path, if you continue to smoke, if you continue to remain sedentary, if you continue to soak your brain in these horrible attitudes coming from all these forms of media that a person could stay engaged in, being too involved in the negative information campaign out there. And so that can lead them to make some life changes, repair old relationships, maybe make a healthy change in their job situation, their relationship situation, or, and most importantly, changing their diet, their habit patterns, get rid of unhealthy habits and some things like that that can make a big difference in their attitudes. Chronically depressed people can benefit from a 20-minute walk once a day for a week. I've even had that as an assignment in somebody that's so dug in that we're not getting anywhere, and I would talk them into making a commitment. Go to the mall, walk 20 minutes, give me that once a day for 5 days, and then let's see if you don't find that your attitude is better, that you don't feel better. And almost always they will report that they feel better. I've even had where a smoker was having a lot of trouble kicking cigarettes, then I would assign that to them. Give me these items on your diet, exclude these items on your diet, and give me a 20-minute pleasant walk through your neighborhood or at a shopping mall or a place that you want to be, just 20 minutes a day, and see if that doesn't affect your urge to smoke, and you find it does. Because walking and eating healthy is incompatible with smoking, and that creates cognitive dissonance, and that is what's going to help them resolve that. So the midlife crisis can be a good thing, and it's a topic for health psychologists.